mobilizations, I'm always mobilizing the opposite side. So if I'm standing on her left, I'm going to mobilize C0-1 on the right. I want to take my caudal hand, and I'm stabilizing at C1. My cranial hand has the occiput, and I want to make sure I don't crush her ear. And the first thing you could do is just see how much retraction there is. Often, you could tell it's stiff that they can't even retract their neck. So block C1, and I'm going to have Lita bring her head back with me. Now hers is about medium. I wouldn't say it moves great, but it's not totally stuck. So I want to make sure when she comes back, I don't let my arm go back with her. I'm blocking C1. And so what I do is, you could try it passively, but if I passively retract her backwards, she doesn't go very far. So I recommend when you do your setup of techniques, use active assisted motions to get there. So Lita, bring your head back and look down a little bit. Much better. Now she gets a little retraction. Now you want to think about the occiput on the right side. We retracted it to get backwards. And you want to think, how do I get this right side more backwards? Do I rotate right or left? So if I want to get this backwards further, I'm going to rotate her to the right. Now we're working on the upper cervical spine, so the coupling is contralateral. So if I rotated right, I'm just going to side bend her a few degrees left. Then I want to drop my elbow because I want to push really cranial. So this is going to be a dorsal, cranial, lateral push, feeling for the end feel. This is a hard one to feel because you're feeling, what is the end feel? Is it springy? Hers is kind of springy as I get there. So it's not the best C0-1 I felt, but she gets some motion. The cool thing about this test is the mobilization is the exact same. So I set up, I test it, it's stiff, and I want to start mobilizing. So I'm pushing dorsal, cranial, lateral. And at the same time, I'm adding a little bit of radial deviation. So I'm really using my body as an uppercut and not just my arm. So I use my body to mobilize so I can keep my hands relaxed. And then I want to do my neuromuscular reeducation. So you're going to look down towards your right armpit. Go backwards with me, look down and right. Down and right. Good. Look up and left. Down and right. Up and left. Down and right. Good. Down and right. Down and right. Then I'm going to recheck. Now she has better retraction and rotation. And now the joint is much more springy. And that's what I want to feel.